Doctor says she spends too much time with patients and that put her out of business. I got to talk about this. Henry Mason, CEO of Precious Hospice. One of the things that I've been noticing more than ever is that the time doctors spend with their patients has gone down significantly. You guys remember 5, 10, 15 years ago, you go to the doctor, it almost was like, hey, like this doctor was the person checking on your health, your mental. It was almost like a little mini therapy session. You guys really built a relationship. Well, that's how my doctor was growing up. I remember going to Dr. Harvey Eccles, who I saw a couple times in Chicago, who's no longer in Chicago. And I remember just like when you go visit him for whatever reason, you're just there, right? It was not a rush treatment. He was there. He talked to you, chopped it up with you, and you built a relationship with that. And what happens now is now I'm getting a lot of calls from people who are saying, I'm going to the doctor, or the specific doctor who called me for this case. And she says, Henry, I lost my practice because I was seeing patients, insurance was paying me, but I couldn't justify only seeing them for 8 minutes, 12 minutes, 15 minutes if they needed a whole lot of time to talk. And it brought me to this point where I'm one of those people where healthcare has got to figure out a way. And we've got to figure out how to put people first without putting companies out of business. This is important because a lot of people are missing this. We're talking about healthcare deserts. We're talking about access to equitable healthcare. People who care should not be put out of business because they care. They should be given more business and be able to do more for more people. And we got to figure out a healthy balance for that. Right now, we don't have that. There's this thing that she said it was basically you go in, they want you to touch the person's knee and walk away, right? You just stay in there for 4 to 5 minutes. And I said, Jesus, well, what are you going to do in that amount of time? And she said, that's my point. I can't do anything. I don't feel like I'm helping those people doing that. And I said, and that's the reason why, if you're only billing 150, even $200 a patient that comes in, even if it's 300, if you're only seeing 8 people a day, you can't really keep your doors open like that. And again, I'm going to say this because I know a lot of you guys are going to say that's a ton of money. Just the cost of medical, like malpractice insurance will blow a lot of you guys' minds. Like you have no clue how much it costs us to actually keep the doors open in these businesses, which is why when you look at companies and you say this, they make 8 million, 10 million, 12 million a year. It's like, do you know that 5% margin, just 5% margins, doesn't matter how much you make. That's just what that is. But I want us to get to a place where we are able to find some middle ground. I think insurance needs to do a better job of that. But I'm going to say this too, though, because it's important that we see both sides of this. For years, I do believe that some doctors were overbilling. I do believe that. I believe that it was done. Some of it may have been done maliciously or to fatten their own pockets. And I say some for a reason. You all are being pointed into a picture that it's just like a mass group of people, mass group of hospices, home healths, and doctors' offices that were doing this. I don't believe it's the case. I think it's a very, very, very minute group of people. And now we're using that as like the front poster child of everyone's doing that. And I just don't believe that to be true. My fix, though, and I'm willing to open this with anybody that wants to do it, particularly in Atlanta. A out-of-pocket doctor's office where it is subscription-based only. I love the concept. I think it works. I think a lot of people are going to lose access to health insurance because it's not affordable for the average American. And so this is my thought. Precious healthcare, and we do a out-of-pocket subscription-based healthcare where we're not limiting people to 5-minute visits. I don't like it. I absolutely hate it, if I'm being honest. It makes them feel like they're less than. And a lot of you doctors, I want you to hear this too, because we're building them here too. Things are being built to where people can ask questions and get help. They're not being diagnosed, but they can ask questions and get helped about what they're feeling. Again, not being diagnosed, but can point them in the right direction. If we don't figure out how to become one with these tools, how to become one with the people and make them feel valued, they will start to rely heavily on said tools. We talked about Google for some time, and people are saying, well, Google, people just search Google and they go on there all the time and say, yeah, they do, but they can talk to Google for an hour and maybe get the right answer, maybe get the wrong answer, but they can go to talk to you for 6 minutes and they don't even feel valued. They don't feel like they were heard. And if we can't figure that out, what are we going to do? So for me, my thought process is I love subscription-based doctor's offices. I think that is the future of doctor's offices. I think people would be much happier just paying $150 a month. You can come get a visit every quarter, and you build a platform on that where you're available for them, and you can still do telehealth, and you can even say, "Hey, I can even charge extra for a drop-in visit," or you can become like a clinic, like a urgent care of sorts. All those things are great, but we have to get back to a point where we're helping people and we're focusing on people, and people are our number one priority. Let me know if you guys are interested, and if you want to learn more about it, or if you want to come into the academy, let me know. Always here to help. Thanks.